So share screen. Share nak share tu.
Video tu kita sangkut-sangkut kan. Kak Zura, kalau kau pergi dekat link yang ada tu, kau masuk Kak. Aku nak kau dengar, kau tengok nampak ke tak dengan video. Sorry. Ini kita. Wow, ada nampak. Tak Zura, kamera tak Zura. Ambil kamera. Bawah, okey. Sebab bila saya dah masuk, ke sebab tak nampak.
Kita tak tengok siapa yang pilih saya.
Dia dah masuk dah IC.
IC?
Diorang masuk IC kan nama. Kan? Ada scan tak yang tu?
Bakut dah kok tu lah. No. Ramai dah masuk. Mana IC? Kita dah masuk. Ada pilihan.
Mana scan tu?
Masuk tak terang? Terang pakai pohon.
Ini show-nya.
Yang saya tengok tak boleh. Ada tu kan? Kena download scan.
Tak dah kan?
Cakap apa pun. Kita tak.
Sound test. Sorry. Misalkan, okay. Okay dah. Sound check. 1, 2, 3. Okay. Okay, sekejap Betul, saya tak boleh nak cursor. Kenapa Saya nak bagi, okay. Try video. Dapat Okay, dapat. Boleh Okay. Bismillahirrahmanirrahim. Assalamualaikum and a very good morning, ladies and gentlemen. It is my pleasure to welcome each and everyone to our CME online sessions conducted by Unit Kejururawatan Hospital Sultan Haji Ahmad Shah Temerloh, Pahang. It is wonderful to see all of you here And as a gentle reminder, kindly scan the QR code for the attendance. And if you have any question during the sessions, kindly write in the chat box and I will try to answer by the end of the sessions. Ladies and gentlemen, I am Rashida binti Muhammad Yusuf, and today I'm going to share regarding discharge planning for elderly patients with hip fracture. Before we start with the sharing sessions, let us watch videos by Johnson & Johnson entitled Nurses Change Life. Nurse change life and it's changed everything. Okay, ladies and gentlemen, I would like to take this opportunity to congratulate each and everyone, regardless of your occupations, either you're a doctor, nurses, pharmacists, physiotherapists, radiologists, and etc., for your great contributions to the mankind, to our healthcare systems, and hoping that especially currently we are fighting against COVID pandemic 19, and then hoping that we're gonna win this battle in real short. Okay, ladies and gentlemen, for the introductions, I have been working in orthopedic department for 9 years, completed my post-basic in orthopedic nursing in 2017 at College Kejururawatan Melaka, completed my Bachelor of Nursing in 2020 at UITM Puncak Alam Selangor, and currently ongoing fast-track PhD of Nursing, started in October 2020, and currently I am in my second semester at UITM Puncak Alam Selangor. My research focused on discharge planning for elderly patients with hip fracture. And this is the moment taken during those journey. And this is during my post-basic in orthopedic, where we learned about anatomy and physiology. We learned about type of fractures, and we learned about treatment procedures in orthopedic, like applying back slap, POP, tractions, and CMR, and a lot more. Those are really amazing. And then for Bachelor of Nursing at UITM, it is actually PJJ. And as the name is PJJ, I have to travel back and forth every 2 weekly to UITM Puncak Alam. And my specialty for Bachelor of Nursing was intensive care unit. And this is for my current journey. This is for interview session for the fast track program and for defense research proposal that took place quite recently in May 2021. apart from that, I've joined Penang International Innovation and Design Competitions that took place in February 2021. Actually, I've created a website for elderly with hip fracture patients. And this is actually a collaboration between orthopedic department and physiotherapy departments. Everybody have given the 100% commitment, and I appreciate it and thank you so much. Enough with the introductions. Let us start with our CME today. Hip fracture. What is a hip fracture? Hip fracture is the fracture of the upper part of the femur. It can be divided into intra-articular or extra-articular. As we all aware, hip joint is a ball and socket joint. Okay, then the type of fracture will affect the type of surgery that will be conducted to the patient. It can be inside the hip joint or outside the hip joint. Either we are going to preserve the hip or we are going to remove the hip. Examples of hip fracture are femoral neck fracture and intertrochanteric region fracture. Why hip fracture is so important? The Asian Federation of Osteoporosis Society have estimated by 2050 there will be a rise in the number of hip fractures from 6,000 to approximately 21,000 fractures occurring annually, costing more than 125 million USD annually in healthcare costs. And Malaysia are expected to be the highest in the region. Malaysia is forecast to be an aging nation by 2030 when 15% of the population is categorized as elderly. And a group of orthopedic experts has warned of the devastating impact of hip fracture in Malaysia, and an immediate action should be taken into considerations to improve musculoskeletal health as a national agenda. And about literature review on current finding of hip fracture in Malaysia. The incidence of hip fracture in Malaysia was 90 per 100,000 populations, but this actually reported by Lee and Keir in 2007. The average age from 74 to 79 years and 75% were female. 77% had at least one comorbid illness. 26% were considered multimorbids. Chinese 40 to 78%, Malay 8 to 44%, and followed by Indian 12 to 20%. Falls were the most common cause for hip fractures, range from 83 to 100%. Femoral neck fracture was seen in 23 to 62%, and trochanteric fractures in 46% of the individuals. Discharge planning is the multidisciplinary approach to continuity of care after the patient has been discharged from the hospital. It is a process consists of 7 elements, includes identification, assessment, goal setting, planning, implementation, coordination, and evaluations. In other way of saying, discharge planning should start from the first day patient admitted to the ward due to hip fracture until the patient recovered from a hip fracture. The main reason for hip surgery is to allow the patients to regain their pre-fracture functional abilities, to maintain quality of life, and to make them able to perform their activity, daily livings like toileting, feeding, dressing, and etc. So by implementing discharge planning, it will be highly beneficial to the elderly patients with hip fracture. The importance of discharge planning. The average length of stay are widely varies from 5.6 to 45 days, and prolonged length of stay increased 32% of the mortality rate. Complication post-hip fracture includes cognitive alteration, cardiopulmonary, thrombosis, gastrointestinal bleeding, UTI, electrolyte imbalance, pressure ulcer, and infections. Enhanced recovery protocols have been implemented in many hospitals for hip fracture patients, as they have been successful in achieving shorter length of stay, but associated with increase in readmissions rate. When it is increased with admissions rate, it will increase the healthcare workers, it will increase the cost for the hospitalizations. And then, who are the elderly in Malaysia? Elderly is defined as those who age 60 years old and above, and this cut-off age is adopted from the United Nations. How a hip fracture occurs? For the risk factors, it can be divided into 2, non-modifiable and modifiable factors. For the non-modifiable, advancing age, ethnic group, which is Asian, gender, female, premature menopause, less than 45 years, family history of osteoporosis, personal history of fracture as an adult. For the modifiables, it include low calcium, vitamin D intake, which we can increase the consumptions by taking more tofu, almonds, milk, and then apart from that, fatty fish like mackerel, tuna, and also salmons. And then for the patients with sedentary lifestyle means lifestyle without physical activities or very low physical activities. Usually they will sit or lying while watching televisions, play with their smartphone or playing games. So basically it's advisable to have an active lifestyle, like we are going for jogging, walking or hiking. It's very useful. And then for smoking, alcohol intakes more than 3 units daily, caffeine more than 330 mg daily, low BMI less than 90, estrogen deficiency, and frequent history of falls. This is what a healthy bone and osteoporosis bones looks like. For the healthy bones, it is strong, its density is well, and then for the osteoporosis, you can see it's like sponge structures, lost its bone density and easily become fragile and can easily lead to fracture. This is what our daily activities might be, and without precautions, we might end up with fracture. Symptoms of hip fracture: unable to move, lift or rotate the fractured leg, severe pain around the hip and groin area, not able to stand or walk. The affected leg appears shorter and the foot is turned outward compared to the unaffected leg. Stiffness, bruising, and swelling around hip area. This is the pre and post-op care. For the pre-op care, maintain bone alignment. We apply skin or skeletal traction based on patient's body weight. DVT prophylaxis, we might consider Clexane or Fonda to the patients according to the patient's conditions. For the TET stockings to prevent deep vein thrombosis. Ensure hemodynamically stable and fit for the operations. As we all aware, elderly have a complex health needs. They will have some medical conditions like diabetic, hypertension. They will have problem with their heart, their kidney, and it is not really straightforward cases. So it is important to refer to other multidisciplinary team as indicated to prevent from further complications. Chest physiotherapy is very important. For example, incentive spirometry and deep breathing exercises. It is very important to prevent from hospital-acquired pneumonia. And then for the post-op care, we have to maintain patient's hemodynamic stability. Wound care, it is very important to prevent from surgical site infections. Early ambulation, good nutritional status, and continue multidisciplinary care to ensure the continuity of the care. This is the type of surgery for hip fracture. There are 3 common surgery for hip fracture patients. As we can see, number 1, hip compression screw. A screw is inserted into the femoral head and the lateral side plate hold the fracture part together. For the partial hip replacements, it involves the replacements of the femoral head and the socket. For the total hip replacements, it involves the replacements of the femoral head and the socket. This is do and don'ts for post-hip surgery. Basically, the advice will be given before the patients undergo the surgery. It is very important for the patients and their caretakers to understand the reason for do and don'ts post-hip surgery. It's meant to protect the operated hip. For do, continue non-weight bearing for 6 months and continue to ambulate using wheelchair and walking frame. When sleeping, either lie on back or side, keep a pillow between thighs. Sit slow, sit down properly when passing clothing over feet to dress up. Place commonly used items above the knee levels like things along the kitchen counter and sitting while preparing food. Take rest periods between activities and increase daily activities. Make good use of equipment at home, such as installing grab rails and grab bars in the bath. Use chairs and bags according to one's own height to prevent from climbing or sitting in the low positions. Use sitting toilet. For don't use car with the deep bucket seated. Sit on a pillow to increase the seat height. Do not drive for at least 6 to 8 hours post procedures. Do not drive for long driving hours. Get up and walk around every 2 hours in a long driving hours. Do not lift heavy objects or do not do activities which requires to stop or turn suddenly. Don't sit on a low soft sofa or chair. Don't lift knees higher than the hip level. Don't bend to pick up objects from the floor. Use reaches or grabbers to pick up items from the floor. Cross legs while standing or lying. This is the ambulation post-hip surgery. For elderly, considering of their physical weaknesses and instability, we advise them to ambulate via wheelchair or walking frame. They are not advised to use walking stick or auxiliary crutches because they will have a high tendency to trippings and risk of falls. Follow-up post-hip surgery. It is very important to remind the patients and their caretakers about the importance of coming for follow-up because there are some barrier that might inhibit the patients to come for follow-up. For example, financial, transport, and they do not have the caretaker to accompany them to the follow-up. So we have to make them understand by giving a proper health education on the importance of the follow-up post-hip surgery. So the common follow-up the patient might be having during for the hip fracture patient, which is orthopedic follow-up to monitor the wound and the fracture, and then physiotherapy follow-up for ambulation and gait training to make sure the patients regain their pre-fracture functional abilities. For the medical follow-up for other comorbidities, for example, hypertension, diabetes, and etc. For the optal follow-up for the visions, because we all aware elderly have some vision problems that might increase the risk of falls. And this is actually a fall prevention checklist room by room. It is meant to prevent from incidents of falls at home. Number 1, bedroom. Keep a light, a lamp, light switch, or night light near your bed. Sit down to get dressed. Keep loose item off the floor. It is to prevent from stripping. For the stairs and hallways, add handrails on both sides of the stairs. Install anti-slip strips on each stair. Install night lights along the route from the bedroom to the bathroom. As this is very important because I've seen a lot of patients in the middle of night, elderly, they have vision problems and they have urinary incontinence. So they have the urgency to go and passing urine and run in the darkness. So end up with tripping and falls and lead to hip fractures. For the bathroom, use a shower chair and handheld shower head while bathing. Install grab bars near toilet and shower. Put a riser seat on the toilet. For the kitchen, move things so they are within easy reach. Use dining chairs that have armrests and no wheels. Don't clean with a high gloss wax floor protectors. At the living room, move carts or other objects out of the walkways. Use the cushions of seat riser if your chair is too low or easily stand forms. And then remove throw. All for my sessions of the day. If you have any questions, you might leave in the chat box and I'll try my best to answer the questions. Is anyone having any questions? I'll try my best to answer. So far, we do have questions. So far, no. Okay, we'll wait for 10 minutes if anybody would like to ask any. Meanwhile, you can just scan the code for your attendance. Okay, don't forget, another gentle reminder, kindly scan the QR code for the attendance. Right. Okay, I'm hoping that today's sessions. Sorry, other question. I think I have a questions. Ida Marina Imam. I have a suggestions. Yes, you just write down what is your suggestions. You are welcome. How to scan the QR code? Okay, you can see at the slide. You can just directly scan from my slide. Boleh terus je scan dekat slide ni, kita dah ada QR code kan. Jadi scan sahaja. Can you, okay, anybody? Dah boleh Semua dah boleh scan. Terima kasih sebab sudi dengar kita punya sharing session untuk hari ini. Any other question? Kalau Doktor, 5 minutes. Ida Marina, I have suggestions to incorporate the false guidance for hospitalized older patients. That can be downloaded in the patient safety website. Maybe you can just share the links so everyone can just download and look at it properly. Yes, great. Thank you so much, Kak Ida Marina Azman. Norzunita Mukhtar, yes, I'm welcome and thank you Stu for joining us today, spending your time. Okay, Matron, tanya doktor. I think that's all. Okay, I think that's all for. There are. Yes, you can have. Okay, we can send because they ask for the slide. Okay, we will put it in our YouTube live. Okay, just go to our YouTube live, subscribe our YouTube, then you can get the slide. Okay. Thank you from KK Tanjung Lalang. Thank you so much for joining. What else? There are numbers of checklists that could be beneficial for everyone of us in taking care and managing falls in elderly patients. Yes, I agree. So maybe we can upgrade later on and we can discuss further on this maybe next time. Thank you, Sister Azni. I think that's all for our sessions today. Thank you so much. I'm sorry kalau ada kelemahan, kekurangan dalam kita punya presentation. InsyaAllah kita akan improve in future. Okay, stay safe. Have a nice day. Assalamualaikum. Okay, doktor. Ini aku bagi. Habis.